In today's studio session, we delve into efforts aimed at limiting the potential impact of an Omicron onslaught on the local front amid the distribution of COVID-19 treatment pills. For more, I have Professor Yu Byung-wook from Sooncheng University. Professor Yu, it's a pleasure to see you again. I also have Dr. Kim Seung-taek at Institute Pasteur Korea joining us live on the line. Dr. Kim, it's a pleasure to see you.
Good afternoon.
Right, Professor Yu, let's start here. The decline in our daily COVID-19 tally appears to be slowing down. Do you believe Omicron is to blame?
Well, until last Saturday, it seems to be was slowing down. But yesterday and probably today and tomorrow, they will show you the kind of different phase of the COVID-19 situation. Because usually weekdays and weekends, they are different because number of COVID-19 tested cases is different. But it's slowed down very slowly either yesterday and probably tomorrow. So, which means COVID-19 situations, so still Korean government will depend against the Omicron well, because the outbounding patient will control it, but unknown spreading in domestics, we don't know exactly how much is spreading in Korean peninsula. So I believe seems to be very stable to go this week, but from the next week can be a slightly going higher again, because what you mentioned depend on Omicron spreading in Korean peninsula.
I see. Meanwhile, Dr. Kim, last Friday, as my colleague Yeon-seung mentioned earlier, 9 COVID-19 patients receiving care at home here in the country received Paxlovid. Now, on the priority list are those aged 65 and above, as well as those with weak immune systems. What more can you tell us about those who are eligible for the antiviral pills, Dr. Kim?
Well, first of all, the reason for we actually set the some priority list is that the supply is not enough. I mean, this is not just a problem in Korea, but for other just countries as well. So every country is trying to get as much as just the drug as possible. So kind of just the priority list is that the people with high risk factors, including the elderly people, and then also people with the underlying medical condition. And one of the underlying medical condition actually includes some weak, just the people with a very weak immunity. And that those people include the people who experience some organ transplant. And therefore, this the patient actually just takes some immunosuppressive drug, because in order to just prevent any rejection of the transplanted organ from the body. Another group of people is some people actually just taking an anti-cancer treatment, and also people with some autoimmune diseases. And well, this is kind of just underlying conditions for with some high risk factors for this COVID-19. And then there are some also concerns, maybe some the people who actually have to just avoid some Paxlovid. And then most represented thing is some Paxlovid side effect is some liver damage that's actually caused by the Remdesivir, which is actually one of the drug of the Paxlovid. And then this Remdesivir actually is known for, well, this has been used since 1990s. This drug also is one of the drug component of the some aged just for the drug for the aged patient. So in terms of the features and the safety profiles of Remdesivir is pretty well known. So I think it's just a 5-day course of this drug. This is not for just a chronic disease, and then it probably for most people would be okay.
Right, and Dr. Kim, staying on the treatment front, that is, Remdesivir, which has been used to treat severe illness, will be administered to those in hospital for moderate symptoms, I understand. What are your thoughts on this?
Well, the initial clinical trial was actually for the Remdesivir is actually conducted for some hospitalized patients. One of the reasons is that this Remdesivir is not just an oral drug, and this is a intravenous drug. So this has to be administered by the sort of just injection. So the set of just all the participants of the drug clinical trial was just hospitalized the patients. But now this Remdesivir is basically this is antiviral drug. It's like molnupiravir and Paxlovid. The mechanism of this drug is actually just inhibiting just virus replication, and also especially just in terms of just mechanism of action, this is very similar to the molnupiravir. But the major difference compared to molnupiravir, this is injection drug, and then the molnupiravir is just oral drug. So initially, the drug was actually approved for the hospitalized patient, and then mostly for the severe just COVID-19, and then actually taken mostly just 5 days in the hospital. But last year, the Pfizer actually tried the phase 3 clinical trial of this Remdesivir for just the mild and the moderate just COVID-19 patients. And then the outcome from the Pfizer is that actually for this phase 3 clinical trial, a total of 562 just the people, COVID-19 patients actually participate in this clinical trial. And then the result was that in terms of primary endpoint of hospitalization and death, actually 87% of efficacy is actually just blocking progression to the some hospitalization and death. And that this efficacy is very similar to what actually we observed for the Paxlovid phase 3 clinical trials. And if we set down the some endpoint as medical visits due to COVID-19, also death, even just the efficacy is the 81%. So, I mean, in terms of efficacy, this is just pretty good. And I think one of the reasons actually our government is considering Remdesivir for mild and moderate COVID-19 is that while some monoclonal antibody, especially the monoclonal antibodies from Celltrion and others, including Regeneron and Eli Lilly, actually their neutralization capacity was sharply actually dropped against the Omicron variant. So we need some alternatives actually deal with this Omicron variant. But anyway, now we have just Paxlovid and then Molnupiravir. Although this is the injection drug, maybe Remdesivir would be a very just a big surplus. And well, in addition, I want to say that Gilead Science also developing the Remdesivir as an oral pill, not just the injection drug. So if this is well successful, this would be just one big plus for our just the capacity to deal with some COVID-19 pandemic.
Right. It would also be really convenient, of course.
Sure, of course.
Professor Yu, starting on this Monday, COVID-19 prevention measures here in the country have been extended for 3 more weeks, but the cap on social gatherings has been eased to pave the path for 6 people to gather socially. Are these current guidelines, you suppose, enough to offset or keep Omicron at bay?
Well, someone probably are disappointed. Someone are, say, the welcomes. Only the little change from the less than 5% and now less than 7%. But anyway, so the Omicron variants, as I mentioned from the beginning, now is the borderline control is the first line defense. The people who should be 10 days who are vaccinated or not should be the quarantine. So most of cases, more than 80% would under the borderline control and the quarantines, we found in Omicron. But Omicron will be dominant variant in Korean Peninsula soon. So which means these 3 weeks, the social distance measure help to save the time to prepare with the big hit and the new wave. It will be another crisis. So cannot be prevented 100% of the Omicron crisis in Korea, but probably we have time to handle it to preparing to the real big hit.
I see. And staying with Omicron, following its alarming spread in Europe and the US, Omicron is now making its presence felt here in Asia. For more on that, I have Melbert Reyes, the head of the Philippine Nurses Association, live on the line. It's a pleasure to have you back, Mr. Reyes.
Good day, Sunny. Thank you for having me here again.
Right. COVID-19 infections in Philippines has been hitting well above 35,000 cases a day over there, of course, in recent days. Could we start with a bit more about the COVID-19 situation in the Philippines, Mr. Reyes?
Well, the resurgence of COVID-19 cases came after the national government eased all restriction to increase the consumption of the people during the holiday season as a solution to revive businesses and profits after recording series of very low case last December. As of yesterday, about 37,154 new cases were recorded. And what is very alarming, it includes health workers, now despite being vaccinated.
I see. So there are breakthrough infections there. Mr. Reyes, the Philippines is still reeling from the aftermath of last month's Typhoon Rai. Having said that, how are authorities there seeking to contain the resurgence in COVID-19 infections while supporting typhoon relief efforts?
Yeah, as estimated, 16 million people in 6 of the country's 17 regions are affected by Super Typhoon Rai. leaving 2.4 million most vulnerable people in need of assistance. Needs are tremendous: shelter, food, water, clothing, medicines, etc. But the country is recovering through responses of the humanitarian community partners in support of the government local response and relief efforts. No, it is somehow it would might affect the situation might affect the spread of COVID-19 because of these circumstances. To mitigate the spread of the coronavirus, days before the coming of the super typhoon and post typhoon, contingency plans have been done by the government through the local government units and other agencies and task force to manage evacuations of residents and families in order to observe health safety protocols, specifically the wearing of masks and observe physical distancing at the evacuation centers.
I see. Also, as part of efforts to contain the spread of COVID-19, I hear, Mr. Reyes, the unvaccinated have been banned from public transportation. What has been the public response to this measure?
The Philippine government banned the unvaccinated individuals from public transport following President Rodrigo Duterte's order to restrict the people's movement as COVID-19 infection surges. The ban will cause more problem, and it does not address the root reason why many are not getting vaccinated, which is access to vaccination at this time. Various reactions came from different sectors. To some, the policy of no vaccination, no ride in Metro Manila perceived as explicit coercion of the masses and outright violation of the right to mobility. Others challenged the government to accelerate and expand the vaccination drive by providing incentives for hesitant Filipinos to get vaccinated. To some, it is meant to avoid complete transport shutdown if more public transport personnel test positive for COVID-19.
I see. Last August, Mr. Reyes, you were on our show to share with us the challenges faced by health workers there on the front lines of the pandemic. What has been the impact of the latest rebound in cases on the medical arena in the Philippines?
Well, the current healthcare system in the Philippines is still struggling to cope with the challenges and impact of the resurgence of COVID-19 cases, especially lack of manpower, so as not to overwhelm hospitals and healthcare workers, who many had been sick or infected with the coronavirus. The Department of Health recently issued latest policies and guidelines on quarantine and isolation. The changes in policy came after the DOH allowed hospitals to implement shortened quarantine and isolation for fully vaccinated healthcare workers to address the lack of manpower as COVID-19 cases reached unprecedented highs this month. The health experts in the country believe that shortening quarantine outweigh the risk, especially for this Omicron variant.
I see. All right. Again, a very big thank you to you and your colleagues, Mr. Reyes, for your selfless dedication to fighting COVID-19 and for your time and thoughts today.
Thank you, Sani.
Right, back here then on the local front, Dr. Kim, authorities have spoken about adopting a new level of response should our daily tally hit above 7,000. Now, why is this threshold important?
Well, I think the government actually considers our healthcare capacity to actually deal with this, especially the Omicron variant. I think the Omicron variant will soon be some predominant variant even in our country as well. So the Omicron variant, now people somehow now consensus is that this is more contagious. It's spread very well compared to the previous variants, 2 to 3-fold more faster. And also, although they show generally some mild in terms compared to the previous variant. So basically, this is to consider our capacity and also to buy some time. I mean, this is the very fast spreading the virus. So if we the number of total confirmed COVID-19 is now 7,000, it could quickly become the 10,000, even more the 10,000, the 20 or the 30, 30,000. So this is basically to buy some time and then just consider our healthcare systems.
Right, I see. Professor Yu, once our daily tally surpasses the 7,000 mark, apparently, our testing method will include the rapid antigen tests as well. What are your thoughts on using these rapid antigen tests?
Fortunately, Korean government, we have a capacity to weekdays base at least 450,000 PCR we can do. Maximum is 700,000 we can. So which means we still have a good capacities. But if Omicron's attack to Korean Peninsula is like US and Europe, probably the shortage can be happening. Why? Because the many medical professionals can be isolated or be treated because Omicron itself. So shortage of the hands can perform of the PCR test. But problem is, first negatives who are COVID-19 Omicron cases, but rapid antigen test cannot catch it. It can be make another issues. So still insist, keep on the PCR test as standard. But if we have any emergency cases, crisis, real case crisis in medical delivery system and diagnosis system, detective collect, that time we should be prepared for kind of alternative, but still we are using standards as the PCR as a standard should be.
Right. And staying with testing, Dr. Kim, some researchers claim a throat swab may be more effective at detecting Omicron than a nasal swab. What are your thoughts?
Well, there are depending on the different type of diagnostics. So some people say the throat swab is much accurate than those drugs. And then I think some experts even just argued that from the dose, the people we are actually detecting more like some live. It's not really the technically the correct term, but live virus from the actually dead virus. But from the throat, we are actually detecting some more like some live virus. And I think even just before we distinguish some nose and the mouth, just for taking the samples, there are some complicating factors. In the case of nose, I mean, some countries actually is recommending just blowing just the nose before actually taking samples out of the nose, because some the contaminants actually might disturb the readings of all the PCR test. And also from the mouth, some residual food in our mouth can actually compromise the result of even RT-PCR result or like a rapid antigen test result. So maybe blowing nose and then the mouth washing is one of the recommendation for prior to the taking the samples for the COVID-19 test. And in terms of maybe the sensitivity, I think obviously the PCR method is superior than the other method. But sometimes, depending on some different rapid antigen test, some people argue that maybe infectivity, in terms of infectivity, rapid antigen test might be just an alternative to some PCR test as well.
Right. Professor, you also under a 7,000 daily tally scenario, clinics within neighborhoods will be asked to treat COVID-19 patients. This was something my colleague Sua mentioned earlier. Now, there are concerns about this particular plan. What can be done to ease such concerns?
If we are open the chance to attend the COVID patient from the primary care systems, probably there are more people can be contaminated and contagious condition. But we have the experience, it was 2009. Yes, we have an H1N1 influenza crisis. That time, primary care, secondary delivery, tertiary level of hospital, yeah, we attend patients. But we don't claiming about it. We're not too worried about it because we knew influenza somehow. But COVID-19 is very new and unknown virus. But now we are knowing a bit than before, but still we don't know. That's why we worry about it. So how we can preparing this condition? First, should we prepare the COVID-19 oral pill first, can be treated immediately. Second, now time to discuss change of the idea and consensus about COVID-19. No more level D protection like astronaut, medical professional. And we are going to have the COVID-19 Omicron variant or other further is change like the endemic and like influenza. That time, we can easy to accept to go to small clinic to see our hometown doctor. But same idea like these days, probably no one go there because we are scaring still. We don't want to go because we are dying from COVID-19. We believe that.
Right. Dr. Kim, in response to the legal dispute over vaccine passes, authorities have decided to lift their requirement at a number of venues, including movie theaters, museums, and large retail stores. What are your thoughts on this?
Well, there were actually just the opinions were actually sharply just divided, especially for the vaccine pass. And I think the sort of the decision this morning actually just reflected the some current status of the COVID-19 in Korea, and also resolved the some conflicts regarding the recent very contrasting court the judgment. Well, I think there is no 100% just a correct answer for this kind of just very hot issue, because depending on which factors we actually prioritize, actually answers might be very different. But anyway, just regardless of just answers, I think all the experts and our authorities actually just consider I think in large the three different the factors. So first is the long-term projection is living with COVID-19, and then now we have, in addition to quarantine and the social distance measures, we have now just two more weapons. I mean, the vaccination, also just the drugs, or especially just oral drugs, and then we are also just considering the burdens and the capacity of our healthcare system. And this is actually not just a big a change. I mean, even just compared to the prior to the Omicron, the variant, but now just one of the big variable that we have to just consider is now just the Omicron variant. So all those things now we are actually taking into consideration and kind of just compromise. And then what kind of factors we are actually just weighing more. So yeah, I think this is actually a very tough decision. I think, but we are still just very on the right track on the dealing with the current situation.
Right. All right, Dr. Kim, as always, thank you very much for your time and your thoughts. Professor, you here in the studio, thank you for being with us today.